Hello everyone, in this video we will discuss more about the pancreatitis. As we know, the pancreas is the gland which is retroperitoneal one, means lies behind the peritoneal. So pancreatitis is the inflammation of the uh, pancreas, which is characterized by the abdominal pain. There will be nausea, vomiting, there may be blood in the sputum, uh, rise in the serum amylase, and rise in the serum lipase. So the rise in two values should be more than 3 to 4 times their normal ones. So that will confirm the diagnosis of the pancreatitis. Etiological factors we have already discussed some about that. Alcoholism is the first one, then comes the gallstones, some kind of medications, some obstructive diseases, ectopic pregnancy, etc. are responsible for the pancreatitis. Uh, these were the etiological factors, and now we will see some of the physical signs available. The changes in the flank areas, ecchymosis, a discoloration of the flank areas is called the Gray Turner sign. Blue discoloration of the periumbilical area is the cullen sign. You might have seen this kind of signs in case of matching, it is given. And if we take up the X-ray, like this is the pancreas and this is the duodenum. As we know that the pancreatic duct opens up at the ampullae of Vetter. So this loop will show the fullness, which is called sentinel's loop. This is very important. The question is asked many times, you people have seen. There might be the fullness of the colon areas is also seen. In case of pancreatitis, there may be fullness of the transverse colon is seen. Fullness of the transverse colon is seen. The symptoms of the pancreas starts resolving in 2 to 7 days in case of acute pancreatitis. One more thing over here is that the criteria about the question is asked is Ranson's criteria. In this, the patients, some of the scores are given in this, in which if the patient has age more than 55, WBC is more than 16,000, lactose dehydrogenase is more than 350, SGOT or AST, SGPT or AST is more than 250, and there might be hypoglycemia more than 200. So this is very important, and question is asked about whether the Ranson these values are belongs to Ranson's criteria or not, or there is hypocalcemia which is less than 8 at that time. There is one more criteria in which Glasgow scoring system is used, in which A this is the same age, same WBC is more than 15,000, and blood glucose is more than 180, and calcium is less than 8, and blood urea nitrogen is more than 45 milligrams per dilution, or partial pressure of oxygen is less than 60 mm of mercury within the 48 hours. So this type of questions are asked that they belongs to the Glasgow scoring system or Ranson system. In the best method to identify about the pancreas is the CT scan. In the CT scan, we came to know the lining of the pancreas shows changes. The boundary shows of the pancreas started showing changes, which is not identifiable in case of X-ray. And if there is any complication, then there might be the necrosis of the like we can say necrosis of pancreas, where there is the uh, destruction of the fatty cells, and which is form a boundary around it, is called granuloma. So for that to know, a fine needle aspiration under CT scan guidance is done for the aspiration of the pus. To know about the pancreatic necrosis, or there might be high fever, leukocytosis, persistent abdominal pain. And next one is the pseudocyst of the pancreas. This is very important. Pseudocyst of the pancreas. Pseudocyst of the pancreas. In case of pseudocyst of pancreas, the cyst might be more than 1 centimeter. Fluid collections are there. So there is the development of the pseudocyst, which resolves slowly and which can be easily seen in the ultrasonography. And for that you have to undergo this surgery. And the question mostly is asked, you have to remove the 1 centimeter area surrounding that extra 1 centimeter area surrounding the pseudocyst of the pancreas. This I remember when I was studying about that you have to remove the 1 centimeter extra during the surgery of the pseudocyst. And there might be some complications. In case of pseudocyst, it pressurizes the other organs. The left diaphragmatic area shows higher than the normal one. It will rise above left diaphragmatic area. There might be one more complication, pancreatic abscess. It is loculated walled of collection was resulting from liquefaction. When there is liquefaction occurs, the lipase breaks down the cells. Lipase activity increases in the serum lipase activity increases in case the pancreas and lead to the liquefaction. So there develops the abscess, and this abscess uh, will be in the lesser sac. This is important one. Again, we have to take up the needle aspiration under the CT scan. Surgical drainage is only required when percutaneous drainage of pus is not helpful. Only then surgically it should be done. There might be ascites too due to the pancreatitis. So this was all about the points about the pancreatitis. Sometimes asked in the questions. Let me check anything else left. There might be hyperlipidemia. Yeah, abscess formation. So the sign in which I was talking about earlier was when there is fullness of the transverse colon or the ascending colon or the descending colon is seen. This is called the cut-off sign. In some cases, we can see out, take the help of barium meal X-ray, in which we can see enlarged C loop of duodenum, as we have seen the picture already. So enlarged C loop, this loop will increase in size. This is due to the increase in the swelling of the head of the pancreas. And there might be shock. So the conservative treatment is must for that. Due to the excessive vomiting, there might be patient might develop the shock. And other things mostly I have told. There is a little bit changes in practice of medicine and surgery book, that Ranson's formulas ranges are little bit different. So you have to go according to the both. Like in age has shown 55 in practice of medicine. This is 15,000. WBC is 15,000. This is 200. Mostly in case of the pancreatitis, this treatment is the surgical removal. After excluding all the other points, the physician has to undergo the removal of the pancreas. Mostly points I have counted over here, like almost covered. So we will discuss next in pancreatitis, about this chronic pancreatitis too. I will tell you little about this. Recurrently occurring cases of the pancreatitis or relapsing cases of the pancreatitis is called the chronic pancreatitis. The same common etiology is there. There is steatorrhea, anorexia, weight loss, malabsorption syndrome, jaundice, may be present pain in epigastric region that is extending to the back, weakness or fatigue, vomiting, jaundice. There is one test which is very important. There is decreased pancreatic secretions are found out by decrease of pancreatic polypeptide level in response to secretin and diminished trypsin value. Pancreatic secretions got decreased in case of the chronic pancreatitis. There is Lund test, LUNDH test. In this test, a test meal is given orally and the duodenal juice is collected for 2 hours after the meal by aspiration. This is very important, sometimes asked about this test. Food is given and after the 2 hours the duodenal juices are aspirated, and if trypsin is normally more than 9 microequivalents and trypsin is more than normal trypsin is more than 9 micro equivalent per minute per ml. If in case of the chronic one it is lesser than 2. Same again the C loop test in case for the barium X-ray, ultrasonography, computed tomography, CT scan is important. Rest all is the same in this case. Surgical treatment, etc. I have already told about the pseudocyst of the pancreas. Very important. The pancreatic secretions and blood escape into the lesser sac, and the formation of in the foramen of the Winslow is sealed by inflammatory exudate. This causes encapsulation of effusion. This point is too important. हाँ जी there might be epigastric swelling in the main symptom of the pseudocyst. There may be anorexia, weight loss. Kehr's sign may be positive, indication irritation of the diaphragm. When there is irritation of the diaphragm is there, this is called the Kehr's sign in pseudocyst of the pancreas. Investigation for pseudocyst of the pancreas is again straight X-ray, barium X-ray, ultrasonography, CT scan. They might be ruptured into the pseudocyst might be ruptured into the abscess formation, peritoneal cavity, bleeding from varices secondary to the portal obstruction. It must be remembered that if any significant symptoms exist, surgical intervention is indicated if one assumes that the pseudocyst wall maturation has already occurred. If the maturation of the wall has occurred, so we have to remove it surgically. So these were in the points about the pseudocyst of the pancreas. Next we will discuss later on about the carcinoma of the pancreas, etc. The only important points I will discuss about. Thank you.